We humans suffered a recent health crisis, and for now one severe health crisis is kind of announced by our health organizations, as this not if, but when. So, if health and health crises are of importance, scientists and humans alike should have the opportunity to be informed about what could matter, and able to research about, and to make their own recommendations and choices. The way things are now, scientists cannot recommend, and 8 billion humans have no choice, simply because of incomplete research and/or lack of useful conclusions. Complete research and/or useful conclusions would be in the favor of scientists and science, individuals and humans in general, but also in the favor of the Amazon Amerindians themselves, who do not dispose of medical assistance, largely because of their isolation in the Amazon forest or region, and the disrespect they suffer at least since the conquests in the year 1500. This video and series do not involve sales of any products or methods, simply because there are no products or methods that can be sold. As said, there is just a large group of humans with unexplainable health that have put themselves at the disposal of scientific research for over 20 years at great effort of all parties, but no relevant conclusion is agreed upon or informed to us 8 billion humans. If humans would gain interest in buying such products for their consumption, they should buy from agroforests similar to the agroforest parts of the Amazon forest. Such newly grown agroforests should be grown outside the Amazon forest, in Brazil or in any other country or countries. What this series really is in the first place a pledge for efficient research of the research data of 20 years of research, including the relevant lifestyle factor that never was recognized nor included. Especially since this research was demanding for the researchers themselves, and certainly for the thousands of the mostly elderly Amazon Amerindians prepared to be researched. We, the authors of this video, assume that when the research started, the involved Amazon Amerindians, which include adults and elderly, were given or had the impression that their involvement in the research could and would bring benefits to all humans. In our view, this bias-claimed expectation was never delivered, since no clear and relevant conclusions or clear and relevant recommendations were ever made. Large numbers of elderly traveled for hours and even several days in harsh conditions to get to hospitals in cities, to go through sophisticated scanners and research methods, something that cannot be done in the places they live for all their lives, amongst others because there is no medical assistance. What the existing reports and publications seem to negate is that these exceptionally healthy people do not consume any food or drinks provenient from agriculture, but from agroforests instead. Exactly this, and nearly only this stands out, and obviously should be researched. And if found consistent, obviously we humans should know it, and have the choice to let our farmers know that we humans would have interest to acquire these products from agroforests as soon as they would be offered. This for health, as well as environmental reasons, including a possible desire to take part in the much wider action plan that is proposed totally for free in this series and channel. We are no doctors. We are members of a volunteering think tank named PDB Think Tank. Important for humanity is that there are 20 years of data from doctors and researchers that are waiting to be used to finally come to a consistent and relevant conclusion, or eventually to amplify and/or expand the ongoing research. These data are for free, and quite accessible, and clearly understandable for non-doctors and non-researchers. You are one click away from something that could be of your interest, and that of humanity.